y'all. Today our NCLEX question of the day says, the nurse is assessing a client who had coronary artery bypass graft surgery 1 day ago and notes muffled heart sounds on auscultation. Which of the following actions should the nurse take? So we know that muffled heart sounds are never normal. So after a CABG, we can have a sudden rush of fluid into the pericardial cavity that increases the pressure within the pericardial cavity, decreases our cardiac output, and we're going to hear muffled heart sounds. So with that in mind, let's look at our options. Option 1 says to administer IV furosemide. This is going to be an incorrect option. We already have decreased cardiac output. We don't want to volume deplete this client. We want to make sure they have enough volume to maintain a good cardiac output. Option 2, it says to notify the healthcare provider. This is going to be our correct option. This client is going to need a pericardiocentesis. There's not a ton of nursing intervention we can do here. We definitely just want to make sure we get the healthcare provider notified immediately. Option 3 says to place the client in the semi-Fowler position. This is an incorrect option. It's not going to hurt this client, but it's not really going to help. Maybe if they're having an increased work of breathing, we could sit them up. That may be helpful, but not the right option. And then option 4 says to document the finding in the client's electronic medical record. We definitely want to document, but that isn't the only thing we want to do. We definitely want to get intervention for this client.